Hi everyone, my name is Lauren Niles, and today I'm here to talk to you about asthma. We are going to discuss what asthma does to our bodies, how to prevent asthma symptoms, common treatments and how to tell if they are working correctly, and how to maintain our health so that asthma does not impact our daily lives. Asthma is one of the most common chronic diseases around the world, is diagnosed in childhood around the age of 3, and continues to affect individuals throughout their lifetime. Approximately 10 to 12% of adults and 15% of children worldwide are afflicted by asthma, with higher instances noted in urban areas. While some individuals who are diagnosed with asthma in childhood may have a reduction or even elimination of symptoms during adolescence, symptoms tend to return during adulthood, particularly to those with severe asthma symptoms. So, what is asthma? Asthma is a disorder in which the lining of the lower airways becomes chronically inflamed. This inflammation is caused by cells in the body that treat the airway lining as foreign and attack itself. Eventually, after these cells have attacked the lining of the lungs for long periods of time, the lungs become hard, brittle, and resistant to expansion, which makes it more and more difficult for asthmatic patients to breathe. The continued attack on the lung cells also causes the airways to swell. Patients with asthma also suffer from increased mucus production within the lungs, which blocks the airways and makes the exchange of oxygen and carbon dioxide within the lungs more difficult. Finally, the airways of an individual suffering from asthma are affected severely by triggers within the environment that would not affect a normal individual. For example, while a normal person's lungs are able to adapt and function normally when the air changes temperature rapidly, the asthmatic patient's lungs would constrict severely and quickly, making it difficult for the individual to breathe. The most common symptoms of asthma are wheezing, which is described as a tight feeling in the chest while breathing, dyspnea, or the feeling that you are unable to catch your breath, and continuous coughing. Symptoms may be worse at night or early in the morning. Patients may also feel they have something stuck in their throat that they are unable to get out, or may need to use their abdominal muscles to help them breathe. Once an individual is diagnosed with asthma, it is important that they avoid what triggers their asthmatic symptoms to avoid the life-threatening consequences that can occur. Common triggers include dust, pollen, weather changes, cigarette smoke, animal hair, infection, and exercise. To avoid these triggers, patients may need to alter their daily habits. For example, patients and family members may need to clean their homes more frequently to avoid dust buildup, choose hairless pets or choose not to have pets at all, and change their plans according to weather changes that may impact their asthmatic symptoms. Avoiding cigarette smoke is imperative. Parents of children with asthma should stop smoking as quickly as possible to avoid secondhand smoke exposure, and children with asthma should never start smoking as they enter adolescence. Places where people frequently smoke should also be avoided. While it may seem that many patients would understand the risks to their health that continuing to smoke has on their overall health, studies show that many individuals continue to smoke and that most of these patients do not identify cigarette smoke as an asthma trigger. Individuals with asthma should not avoid exercise, but should listen to their bodies and only exercise when they feel they are able to without losing control of their breathing. Patients are also able to pre-medicate themselves with asthma medications before exercising heavily. Weight control is also important in preventing asthma symptoms. Obesity increases the likelihood of asthma symptoms, as well as increases the changes for patients to develop other health-related problems in the future. Avoiding infection through simple actions like frequent hand washing also helps to prevent respiratory illnesses. Another important aspect of asthma prevention is consistently taking asthma prevention medications as prescribed by a healthcare provider. There are two types of asthma treatment medications: those that are used for symptom prevention and those that are used to treat symptoms when they occur, or a reliever medication. Asthma treatment medications are selected based on the severity of the patient's asthma. There are 4 stages of asthma severity in adolescents and adults over the age of 12. They are described by Robinson and Wu in 2017 as mild intermittent asthma, where symptoms occur less than twice a week with no symptoms in between exacerbations, and nighttime symptoms that occur less than twice a month. Mild persistent asthma, or symptoms that occur more than twice a week but less than once a day, with nighttime symptoms that occur 3 to 4 times a month, and exacerbations that may affect activity. Moderate persistent asthma, where symptoms occur daily, exacerbations affect normal activity, and nighttime symptoms occur more often than once a week. And finally, severe persistent asthma, where some degree of symptoms occur at all times, extremely limited physical activity due to frequent exacerbations, and frequent nighttime symptoms. For patients with mild intermittent asthma, a short-acting beta-2 agonist is prescribed, such as albuterol, which will open up the airways, relieve wheezing, and ease the patient's work of breathing. The albuterol is taken through an inhaler, which delivers medication directly into the lungs by the patient breathing the medication in through the mouth. For patients with mild persistent asthma, along with albuterol, which is used as needed for sudden symptoms, another daily medication is taken to prevent symptoms before they happen. This medication is usually a steroid, which reduces inflammation in the lungs. The steroid is also taken through an inhaler, but is taken every day to help stop symptoms before they begin. For patients with moderate persistent asthma, an inhaled steroid is taken along with a longer-acting medication to keep the airways open, such as Ceravent. Albuterol is still used for sudden symptoms along with these other 2 medications. In some cases, oral steroids may also be taken to reduce inflammation further. Finally, for patients with severe persistent asthma, all of these medications are used, but in larger amounts and more frequently. In some patients, allergy medications can also be useful to prevent symptoms that occur due to environmental allergens. Unfortunately, there are side effects associated with these medications. In addition to opening the airways and making breathing easier, albuterol also makes the heart beat faster and can cause feelings of anxiety, nervousness, and tremors. Inhaled steroids also have some associated side effects. Yeast buildup in the mouth can occur if the mouth is not thoroughly rinsed after each inhalation. Understanding what causes asthma symptoms and the importance of using rescue medications when needed is especially important for patients to comprehend. By utilizing prescribed rescue medications, patients can avoid serious complications and further exacerbations. Albuterol can be taken as needed for wheezing every 4 to 6 hours. All preventative medications should be taken exactly as prescribed by a healthcare professional. Recent data also shows that educating family, friends, and caregivers is also important and empowers patients and families to take charge of their health and appropriately manage their disease. The effectiveness of treatment is monitored every 1 to 6 months to determine if the patient has been experiencing frequent asthma symptoms. The number of times rescue inhalers are utilized, along with the impact asthma has on their daily activities, and number of exacerbations is noted by the healthcare provider. The provider can then evaluate their progress and see if their treatment can be moved to a different stage, either up or down. During these frequent primary care visits, it is also an important time to review health promotion techniques with patients. As previously mentioned, this includes maintaining health through proper diet and exercise, avoiding asthma triggers, not smoking cigarettes, and being compliant with prescribed medication regimens. Thank you for your attention. Stay safe, happy, and healthy.